Eptacog beta is a novel recombinant factor VIIa molecule. There is one factor VIIa on the molecule on the market called Eptacog alpha. It's been around for 20 years. This Eptacog beta is a novel factor VIIa molecule, which in vitro anyway seems to potentially have some added hemostatic benefit for patients. It has been studied in a Phase III trial called PERSEPT 1, as well as in a pediatric trial called PERSEPT 2. And in those trials, Eptacog beta was used on demand to treat patients with hemophilia A and B with inhibitors when they have a bleeding event. So this is a drug used to treat bleeding when it occurs. The PERSEPT 1 trial in the adolescents and adults led to the approval of this drug for patients older than 12 to treat bleeding events, again, patients with hemophilia A and B with inhibitors. The pediatric study had some interesting findings in the sense that basically there was less efficacy, or it seemed as if there was less efficacy in the children. And what we noticed, though, is that in pediatric patients, parents are not able to really know when bleeding stopped, particularly in patients between 1 and 6 years of age, because those children really can't communicate very effectively. In fact, the younger ones, of course, can't communicate really at all. And so it's very difficult for parents to know if bleeding stopped or if bleeding didn't stop. What we found and what we believe is that the additional doses that were used to treat these pediatric patients and for a longer period of time is likely because parents are not sure if bleeding stopped. And so if they're not sure, the conservative thing to do is to keep giving more doses of Eptacog beta just to be certain that the bleed is being effectively treated. So in this poster presentation, we are demonstrating that the dosing, the number of doses, and the duration of treatment of Eptacog beta for a group of patients with hemophilia A and B with inhibitors increases with decreasing age. So the 12 and up used fewer doses and less duration than those between 6 and 12 years of age, and those between 0 and 6 years of age used the most. And so we think this is not really because the bleeds aren't being treated effectively, but because parents are not sure when the bleeding stops, and so they keep giving more doses just to be sure that they're getting the bleed under control in their children. So that's the main finding of this study, and it's probably more, like I said, a behavioral thing that parents are doing because of, again, the uncertainty of knowing in children when bleeding has stopped.